Today I was saying to our friends and colleagues, at least it's not 80 degrees and so sunny outside. It makes it a little easier to be inside, but really good to see everyone. My name is Nseidu Obit Witherspoon, or everyone calls me Nsei. I'm the executive director for a national nonprofit that's based in Washington, D.C. called the Children's Environmental Health Network. Our basic mission is to make sure that all children have a safe and healthy start out in their life by looking at all of the various hazards that they're exposed to in those environments that they spend the most time. Definitely their homes, their schools, their childcare, their places of worship, playgrounds. There's not too much that's off limits. And we work to promote this mission by supporting the peer-reviewed science, translating that science into actionable, low-key, hopefully low-cost steps that community members can take, science-based recommendations that they can take to, again, make their environments healthier and safer. And of course, we do work on some child protective policies, which is always the hardest to achieve. There hasn't been too much movement at the federal level, but certainly our states have been doing a great job. It's really my pleasure to be our moderator here today. I'm going to get to it because I know we only have until about 20 after 10. They might give us another 5 minutes or so. We want to make sure you guys get to stretch and have your break. You have a wonderful set of panelists here today. I want to thank all of them for coming again and joining with us. I'm going to go ahead and introduce all three, and then we'll get started in order. And what we'll do is if we could just take clarifying questions in between each author, presenter, and then at the end we'll have them all come up and we'll have an open discussion. But any clarifying questions immediately right after, please. Dr. Leziam Quiros Alcala is the assistant professor in the Maryland Institute for Applied Environmental Health at the University of Maryland School of Public Health. Her research interests are on assessing and characterizing environmental exposures and their potential health effects in vulnerable populations, and in the development of education and intervention programs to mitigate those exposures. She will be talking today on why we're concerned about environmental exposures in children, what we know about potential health effects associated with select pollutants presented in the Chesapeake Bay, and what we can do to minimize those exposures. Dr. Jed Miller is a health advisor in the Science Services Administration of the Maryland Department of Environment. There he provides health consultation and coordination for developmental and interagency affairs. Jed also co-chairs the Environmental Health Liaison Committee and is vice chair of the Maryland Children's Environmental Health Protection Advisory Council. He was in private practice as a general pediatrician for 5 years before joining the Maryland Department of Environment in 2009. Jed will be speaking to us on fish consumption and children's environmental health, and he will provide an overview of the Maryland Department of Environment's fish consumption advisories, outreach efforts, and along with some challenges and opportunities for all of us to think about and discuss. Finally, we have Dr. Cliff Mitchell. He's the director of the Environmental Health Bureau in the Prevention and Health Promotion Administration of the Maryland Department of Health and Mental Hygiene. He has been at the Department of Health and Mental Hygiene since 2006. Prior to that, he was an associate professor in environmental health sciences at Johns Hopkins Bloomberg School of Public Health. Dr. Mitchell chairs the Maryland Children's Environmental Health Protection Advisory Council and co-chairs the Environmental Health Liaison Committee. Cliff will be speaking on the priority children's environmental health issues in the Mid-Atlantic region for this upcoming year, in particular 2015, and identify some challenges in healthcare for especially environmental health challenges found under the Affordable Care Act that could potentially affect many of the communities that we're here to discuss and talk about today. So we're looking forward to our discussions, and we'll get started with Leslie.
So thank you, Nsei, for that introduction. Good morning, everyone. As Nsei said, my name is Leslie M. Quiros, and I apologize, I can't look at the screen. And I'd like to think it's both an honor and a privilege to be here with the other panelists. And what I'd like to do today over the next 20 minutes or so is first off give you some background on the Chesapeake Bay and how it's become polluted. Then go into why is it that we're concerned about chemical exposures in children, followed by what we know about the potential health effects that may result from the select pollutants present in the bay, followed by what are some of the challenges that we face when assessing exposures and human risk, and lastly end with how we can minimize these exposures in the face of uncertainty and limited studies. So the Chesapeake Bay is the largest estuary in the U.S., and it's the third largest in the world, covering over 64,000 square miles, with water, waste products, and runoff entering the bay from over 150 rivers and streams, originating from BC and 6 other states, including Maryland and Virginia. Now, it is home to over 17 million people, and it is a source of recreational, subsistence, and commercial fishing. It is estimated that about 500 million pounds of seafood are caught each year for commercial purposes alone. Now, the Anacostia and Potomac rivers are the greatest concern due to fish contamination, and this poses an environmental justice issue, particularly in some populations such as subsistence fishers who rely on locally caught fish as a source of protein and food. And these populations tend to be communities of color as well as low income. In fact, there was a survey that was conducted in 2011 by the Anacostia Riverkeeper Partnership Project, which surveyed 111 anglers, and they found that 67% of them were African American, 18% were Hispanic, 8% were Asian, and only 6% were Caucasian. Now, even though warnings or fish advisories have been issued for over 20 years in DC and Maryland, what the survey also found is that the fishers and community members are not aware of these. A lot of it has to do also with perception. These fishers, when they catch their fish, if nothing looks wrong with the fish, it looks perfectly fine, it doesn't have 3 eyes or anything, then you know what, they think it's safe for consumption. So it's also lack of education. They don't know what chemicals are potentially in the fish and what potential health effects may be associated with these chemicals. So we know the bay is polluted, but how is it becoming polluted? So there's different ways by which chemicals can be transported into the bay, including contaminated storm water runoff, which may arise from urban and commercial development. So for example, when you apply pesticides on your lawn, these may end up in rivers and streams and then end up in the bay. Other contributors are runoff from poultry farms, pesticides or other chemicals that are used for agriculture, air pollution that can arise from industries, especially like power plants or also vehicular traffic, and also wastewater that's just discharged into the bay from industrial facilities as well as municipal wastewater plants. Now, a report by the EPA, the U.S. Geological Survey, and the U.S. Fish and Wildlife Fisheries found that these are the main contaminants that are polluting our bay, including PCBs, dioxins, PAHs, pesticides, pharmaceuticals, and the list goes on. So we know that the bay is polluted, but why are we concerned with chemical exposures in children? So first of all, it's important because fetuses are very vulnerable to environmental chemical exposures. There's different critical windows of fetal development, and the developing organs are a lot more sensitive. So that's why exposures to pregnant mothers, for example, are also of concern. Now, compared to adults, children are a lot more vulnerable to chemical exposures because they eat, breathe, and drink more per unit body weight compared to adults. They have higher respiratory rates, smaller respiratory airways, a higher proportion of rapidly growing tissues, and they're less efficient at detoxifying and metabolizing chemicals. So how can children get exposed to different chemicals? Well, one, during the fetal stage, they can be exposed to chemicals that cross the placenta. They can also be exposed via ingestion of contaminated food, whether it's via breast milk or contaminated seafood. And also non-direct ingestion can also occur from mouthing behaviors in children. A third possible route of exposure is inhalation of contaminated air. And lastly, dermal absorption, but this definitely depends on the individual chemical that you're exposed to and the chemical properties. So what I'd like to do now is focus, for the sake of time, on only 3 of these, the main pollutants that are found in the bay, tell you a little bit about them and what they are, where they came from, and some of the health effects that have been linked to these in children particularly. So starting off with polychlorinated biphenyls or PCBs, these are synthetic mixtures of chlorinated compounds, and they were previously used as coolants and lubricants in electrical equipment because they were good non-flammable insulators, and they were also used in plasticizers. However, they were banned in the late 1970s in the US and in 2001 by the Stockholm Convention on Persistent Organic Pollutants because of concerns for adverse health effects on human health, as well as their persistence in the environment. They enter the air, water, and soil during the manufacture, use, and disposal from accidental spills, leaks, and they are highly persistent in the environment, as I mentioned earlier, and they bioaccumulate. Also, the International Agency for Research on Cancer and the EPA has classified them as probable human carcinogens. And they're also known endocrine disruptors. Now, you've probably heard this word a lot. And endocrine disruptors are essentially compounds that can mimic or alter hormones in your body. Now, contamination of PCBs in the bay is widespread in extent and severity, and they tend to concentrate in sediment as well as in fish, which has led to fish consumption advisories basically throughout the whole Chesapeake Bay. Now, there's different health effects that have been linked to PCBs in children. For example, prenatal exposure has been linked to impaired neurodevelopment, in particular altered cognition, psychomotor function during infancy as well as in younger children, and also attention problems. They have also found altered thyroid hormone homeostasis, and thyroid hormones are very important for proper growth and development of children. And also, there's been an association with decreased length of gestation. With regards to postnatal exposure, PCBs have been associated with impaired cochlear function or impaired hearing, also impaired cognitive function in early childhood, psychomotor development, and a recent study in 2010 found that children who were highly exposed to PCBs had reduced development of antibodies in response to vaccines. So now moving on to pesticides. Pesticides, as you probably already know, are compounds that are used to kill, repel, and control pests. They're heavily used in agriculture, for structural and residential pest control, for public health vector control, as well as landscaping. And according to a U.S. Geological Survey report in 2007, they found that different pesticides are present essentially year-round in streams of the Bay watershed, with agriculture being the largest source. Now, these are some of the pesticides that have been found in the Chesapeake Bay. And like I said, for the sake of time, I'm only going to focus on some of these. In particular, we don't have a pointer, right? I'll just use this. Chlorpyrifos and diazinon, which are organophosphates, and atrazine, which is heavily used. It's an herbicide heavily used on corn. So organophosphate pesticides, or OP pesticides, have been widely detected in the Bay, particularly chlorpyrifos and diazinon. They are used extensively in agriculture. OPs are considered acute neurotoxins. Thank you so much. And once somebody's been exposed to them, what somebody would do is you can measure their exposure by measuring metabolites in their urine. So you're exposed to these chemicals and they break down in your body, and we're measuring the breakdown products. Or we could measure specific metabolites, which represent exposure to a particular OP pesticide. Now, chlorpyrifos and diazinon actually were phased out from residential uses between 2001 and 2004 due to human health concerns. Now, with regards to health effects in children, there were 3 scientifically rigorous prospective cohort studies that were conducted in different populations, including in minority populations in California and New York. They all used different biomarkers of organophosphate exposure. Some used urine, some used blood. There were also different levels and modes of OP exposure in these studies. However, despite these differences, we are seeing similar patterns emerging with regards to prenatal exposure. So prenatal exposure was found to be associated with abnormal reflexes during the neonatal period, and poor MDI, or mental development index scores, at ages 2 and 3. And the mental development index score essentially reflects performance in several types of abilities, including memory, problem solving, as well as verbal communication. They also found a link or an association between OP exposure and poor verbal IQ in children between the ages of 3.5 and 5. And they also found an increased odds of pervasive developmental disorder. Now, PDD essentially describes a group of conditions that involve delays in development of basic skills, including being able to socialize and being able to communicate. Now, atrazine is a restricted use herbicide that's used to kill weeds, predominantly on corn, crops such as corn. It was found in 100% of water samples in one study conducted in 2007, and in animals both prenatal and postnatal exposure have been associated with adverse health effects. However, in humans, there's been limited human studies in children, and what they're seeing is that prenatal exposure has been associated with gastroschisis, which is a rare birth defect to where you have an opening in the abdominal cavity. Also, maternal residence exposure has been linked to an increased odds of male genital malformations, and also exposure via drinking water has been linked to an increased risk of small for gestational age. So now moving on to our last chemical, which is flame retardants or PBDEs. These consist of a group of over 200 congeners, and they're similar in structure to PCBs. They're used as flame retardants in consumer products such as electronics, furniture, and textiles, though they are starting to phase them out, at least the penta congeners, due to health concerns. Now, the pathways by which PBDEs enter our environment are poorly understood and quantified. However, they may enter our local waterways via atmospheric transport for manufacturing and product usage. They are hydrophobic and lipophilic, which means that they accumulate in fat, so they're more likely to be present, and they don't have a high affinity for water, so they're going to tend to accumulate in soils and sediments as well as in fish tissue. They do persist in the environment and bioaccumulate, and they're also known endocrine disruptors. And I haven't mentioned this, but even though there are PBDEs present in fish samples, unlike PCBs, even though they're structurally similar, most of the exposure to PBDEs is expected to come from indoor dust. So some of the health effects that have been linked to PBDEs in children. One study conducted at the University of California at Berkeley found that maternal PBDE levels were associated with lower birth weight after controlling for gestational age. Now these green dots here are your measure of association, and the whiskers represent the confidence interval. When they cross the 0, that means that it's not statistically significant. So we see here that for total PBDEs, as well as individual congeners, after you adjust for gestational age, we are seeing lower birth weight. With regards to PBDE exposure and impaired child neurodevelopment, there's been multiple studies that have tried to look at cognition, motor skills, attention, and there is a pattern emerging. A lot of them are finding significant and positive associations with these chemicals. Also, maternal PBDE serum levels have been associated with decreased IQ, in particular verbal comprehension. And child's PBDE levels have been related to higher hyperactive and poorer attention scores, as reported by teachers. Child PBDE serum levels have also been associated with lower IQ. And I want to, I'm almost towards the end, I don't know how I'm doing on time, but we do face some challenges when anytime we're assessing chemical exposures and health risk. There's what we know and there's a lot that we don't know, right? So for example, a lot of these compounds that are legacy and emerging, we're finding out that they're endocrine disruptors. And like I said, these are compounds that alter or mimic hormone function. And the risk assessments that have been done in the past have not taken this into account. And these are also compounds that may produce an adverse health effect at a low dose, but may not at a high dose. Also, there's, our children and us, we're exposed to mixtures of chemicals, not just one individual chemical at a time. We're exposed to these chemicals from several sources, not just contaminated food or fish. And we don't necessarily always have the right methods to measure the pollutants at the levels that we should be worried about. However, in the face of uncertainty, I wanted to end with a slightly more positive note. And even though, we have limited human studies, there are things that we can do to minimize exposure to our children and our families. For example, we can avoid swimming in and drinking contaminated water. We can avoid playing on or near contaminated sites. We can reduce our chemical use at home and opt for less toxic alternatives. We can take our shoes off before going into our homes, as we can track in chemicals in our shoes. And we can opt for fish that are not bottom feeders. Now remember I said a lot of these chemicals can build up in the sediments, and so bottom feeders, fish that are bottom feeders tend to have higher concentrations of chemicals. And I won't go too much into detail on this because I know Jed will touch on this, but basically there are ways in which you can minimize the exposure from fish by the way you prepare it, and I'll let Jed go into that. So in summary, the Chesapeake Bay is polluted with several pollutants. The consumption of contaminated fish may disproportionately affect subsistence fishers and their families, who are often low income and people of color. Also, children may experience higher chemical exposures given their unique vulnerabilities. And several pollutants are present in the bay, and they've been linked to different health effects, including in children. And lastly, there are some steps that we can take in order to minimize exposures to our children and our families. And I'd like to thank ENSE for inviting me to speak today, the other panelists for being here today, and the audience, as well as the conference or symposium organizers for putting this together. So, thank you.
Thank you so much. Any clarifying questions for Leslie before we move on?
Morning. I'm
Good morning.
Carrie. I work in DC. A little bit some of the data you put out there on the agriculture. I was wondering if you are looking at the pollutant burden on the population that are more subject to the issues. And I'm not actually focusing as much on African American population. I'm more focusing on immigrant population, which with cultural and language barriers,
Yes.
may not be aware.
Absolutely.
I mean, they're all subject to the lack of access to the system and being busy and all of that stuff and poverty. But with the immigrants, they have that added burden.
Yes, absolutely. So your question is what is being done, or has that been
Are
measured?
you all, as you are looking at the populations and the burden on the kids and the pregnant women and stuff like that, are you focusing on that subgroup at all? Or are there initiatives not within your work but in your colleagues?
That's a great question. So we're actually applying for an environmental justice center grant where we want to focus on subsistence fishers, including African American, Latinos, all ethnicities, to measure the extent of these disparities with regards to exposure. So at least there's an effort moving that way. But I don't know of any other work that's been done.
I think some of our other speakers are going to get into some initiatives as well.
So has there been any studies that looked at
Yes, they have looked at obesity, especially PBDEs and some pesticides, I believe. I don't recall what the results were, but they have looked at that.
Sure. Sure. Hope I do this right.
Hi, everybody. I'm Jed Miller. As Insay said, I'm a health advisor at the Maryland Department of the Environment. And thanks, Leslie, for that very helpful overview. It's a very broad topic, and that was extremely helpful, I think. I'd like to build on a few things that Leslie has said, and I'll be talking about fish consumption and children's health overall. And I'd like to just give an overview of the fish consumption advisories that MDE develops and issues, and then touch upon some outreach efforts that we are doing and thinking about as well, and then talk about challenges and opportunities related to eating fish and children's health. So, MDE's advisories, what are they? Well, they simply recommend how often certain fish can be eaten to minimize health risks while enjoying health benefits. And what we do, there's fish, we test fish from various locations across Maryland, including the Bay. And we test them for contaminants that can bioaccumulate, so build up well beyond background levels in the environment. Two of the routine ones are methylmercury and PCBs. And there are also select pesticides that are tested for depending on prior results and whether or not a water body has been found to be impaired for certain pesticides. We don't, however, do a whole suite of contaminants for each round. So these results from the fish tissue, are used in a mathematical equation, and that equation is quite complex, and it factors in the health risks that are posed by the contaminants. And it also factors in things such as assumptions about how much fish eaten, serving size, and other factors. And so this equation calculates how many months per meal should be recommended as part of the guideline. Now, a very important part of MDE's advisories is who is the intended audience. And it's a vital point. And the intended audience is people who eat recreationally caught fish from Maryland on a regular basis. And that includes people who fish in local waters to provide food for themselves and their families. Subsistence fishermen included certainly as a very, very important population, as well as people who eat fish from Maryland that are caught by sport fishermen. And thinking about sensitive, vulnerable populations, we have to think about pregnant women, babies, and young children. As Leslie said, particularly vulnerable to impacts from both methylmercury and PCBs. Think about developing brains and these toxins impacting them. Our advisories include specific recommendations for both women and children. The next slide here is an example of our advisory, which is available at MDE's website, and it's also available in certain select locations as postings. And what you can see here is the top part of this slide shows the information that is kind of the backdrop. The species of fish are there on the left side. The water body from which data have been collected are there in the middle column. And if you go over to the right there, the right column has how many meals recommended per month. That means that the recommendation is not to go beyond that. And there's categories for the general population as well as women and children. So again, I'm not going to go through more of this, but this is an example of our fish consumption advisories. This is the result of our efforts at collecting data and analyzing it. I want to make a note that a few years ago, in 2011, we had an announcement regarding striped bass, rockfish, very important fish in Maryland, certainly. Data about PCB concentrations. This table shows the change in the median PCB concentration in parts per billion in striped bass between samplings in 2001 to 2005 compared to more recent 2009 to 2010. There you can see that there's different sizes. And I'm not going to go through the numbers here, but there were significant drops in the measured levels of PCBs and the median concentration. And I say this as a kind of a note of good news, in a sense, that even though we don't know why, and we can't claim that we're responsible for the decrease, as Leslie said, they were banned in the late 70s, right? These things hang around for a while, though, as you may know. Nevertheless, it's nice to see that there was a drop. Now, this translated into a change in the advisories and everything. Not a huge change. I would call it a modest change, but nevertheless, this is rockfish, and it was a nice thing to be able to announce. Moving on now, outreach. So our goal is to get these advisories and, very importantly, related information out to those who need it the most. We need to give people knowledge to make the best choices. I'll come back to that thought in a minute here. I just want to say, currently in place, we have postings simply printing out advisories or specific advisories for specific water bodies and posting them. As you can imagine, there are problems with this. They tend to get torn down pretty quickly, and some simple things that we've thought about, we hope to enact, are finding bulletin boards or other mechanisms, means by which they can be more secure. We also, and I would say this is somewhat of a success certainly, is we give brochures for Maryland's WIC offices, Women, Infants, and Children. Thinking about vulnerable populations, the WIC population we think is a population that certainly could be vulnerable and that could benefit from the information about the advisories and, again, related information. We also have MDE's website has, of course, the advisories and other information on it. And on that note, available on the website and also what we give to the WIC offices is a brochure that's designed specifically for women, geared towards women and children. It's our fish facts brochure. I have it displayed here on the screen. So one side of it, it's a trifold thing. You can see here talking about simple advice about how fish should be cooked. And if you see at the bottom there, the bottom left of this, Leslie had a similar schematic, drawing on her presentation about how it's best to prepare fish, to avoid skin and to do certain fillet methods in order to reduce your exposure to certain contaminants. For instance, methylmercury doesn't tend to do this, but PCBs tend to accumulate in fat, as was stated earlier, as well as the certain flame retardants. This is the back of that brochure. It has some more specific information in it, which I'm not going to go through, but that's an example of one of our pieces of outreach. More recently, we developed a video, and its title is Eat Fish, Eat Smart. A healthy meal is just a fillet away. Very, very nice rhyming, correct? So this is our first attempt, at least in recent memory, I could say, I doubt it was before, to actually break into the video realm, thinking about how videos can be shared much more easily than they used to, and some people might watch and pay attention to videos more than some other things. And this video is really focused on some data that we gathered in kind of a study that we did within MDE on filleting striped bass a certain way, meaning cutting out this lateral line and belly fat and kind of following the advice that is out there about filleting fish. And we actually found very nice results, especially in larger fish, up to 91% reduction in PCB levels in the fish tissue. So there was excitement about this within MDE. And again, even though you might say, well, that's expected, right? It's nice to see it corroborated with some actual data. This video focuses on the filleting method. This is, I see Cliff here chuckling because this is this wonderful guy, Charlie Pukish. And he's an expert of many things, I would say, including filleting fish. And on the video, which you can watch from our website, he does it. He shows you how to do it and everything, and talks about it as well. Now, certainly, when you fillet the healthy way, you're not left with as much meat, with a fillet that's terribly big. However, it's healthier, and that comes into some things I'll talk about in a moment here. That's our video. I'd like to turn now and kind of close with the fun part of the presentation, what I would like to call challenges and opportunities. So the advisory part of all this, developing the advisories, that's pretty straightforward. It's not terribly difficult. It's a pretty straightforward thing. However, helping people know what they need to know, that's the challenge as well as the opportunity. I like to think of it as whenever you have a challenge in life or at work, there's also an opportunity there to do your best to try to help people. And considering the contaminants that we have been talking about, children and pregnant women certainly deserve top priority. Again, the question is, how do we actually reach the families who really need to know, and how do we convey a meaningful message? Now, these are not questions that I will claim to answer today. I'd like to bring this up as a point for this symposium, as well as there are discussions within MDE, as well as with our partners, such as the Department of Health and Mental Hygiene, about how we can really best help people. Another thing we talk about these days, thinking about web pages. It takes a lot of effort to make a web page something that you want it to be, but then you realize the role of web pages is actually decreasing in a lot of ways, something to mobile devices. And it's tricky to know where the highest yield will be for a certain effort. However, it's certainly worthwhile having a home base for things. But it's always a question about how best can we reach our audiences. And in our era of mobile devices, it's interesting because there were some, I think, Pew surveys looking at ownership of mobile devices by certain populations, and it's not a typical spread that you might think about. So there are potential opportunities for people who are disadvantaged to reach them through mobile devices, and that's something that we're certainly thinking about. A lot of the discussion around fish consumption, again, the advisors are one thing, but it's just general information, simple things that can be very, very helpful about how you fillet, how do you choose your fish. Smaller fish, as long as they're within the legal size limit. Smaller fish, and a variety of fish. Much more healthy to do that than to get the huge whopper fish and eat them, even if you store them in your freezer over the course of several months. So there's a lot of nuances, but there's also very simple messaging that we can use. I think a lot of this is about what, this might be a right term, self-efficacy. Knowing that you can do something and that's worth it. One of the challenges, though, is that you can't see the impacts right away. So that's kind of an inherent challenge with a lot of this. You have to persuade and convert people to think a certain way and to actually have change in behavior and to know they're not going to see it immediately. And that's in contrast to some other things where you might have to get negative feedback about what you're doing right away. This is something different. So that's, again, a challenge, but it also can be an opportunity. And again, just to reiterate the point, you need to understand and be persuaded before you change your behavior. We have to ensure that the message is clear. And this means literally clear, as in, can you actually perceive it? And can you understand it? Is it in your language? Is it written in the right syntax? And also, how can that message be translated into behavior change? When I say behavior change, I don't mean it to sound in any way that's a negative thing for the audience receiving it. It's just that a lot of things that we do, really the goal is behavior change, to help people out, help them help themselves. Next, balancing the message. There are actually different dimensions of this notion. There's been a recent focus on the benefits of fish, the polyunsaturated fatty acids, and how helpful they are. Well, there's other benefits too. Culture, family, friends, all that kind of thing. Enjoying the outdoors. So there's a balance between telling, hey, be careful when you eat fish, saying, well, but eat fish. Please eat them. Just think about it. Make the best choices. Be empowered with knowledge. That's our goal. Another aspect of the balance is the level of detail. One time we got some input, which is very helpful, about, do you guys really need to have those advisories in such detail? And I don't know the answer to that at this point. We're discussing that. For instance, I do feel at present that if we had to have an avoid advisory, where we have data to say, avoid eating this fish, or perhaps only eat it once every other month, I think that's important knowledge. However, beyond that, I'm not sure at this point. And I stand behind and promote our advisories. Because again, when they're used in the proper manner, they certainly have a lot of background to them. But again, thinking about the balance there, about the level of detail, reaching the people who need it the most, these are some of the issues that we're currently considering. And also, to reiterate, there's a lot of value in our general messaging. There's simple messages that people can help themselves with and their families. The next thing is delivering the message in the best context. So if you're a person who needs to hear this message, is the best way to package it and say, we test for contaminants, and here's what we're going to tell you. Versus, what about healthy food choices? How can you choose the healthiest food? Certainly you eat a range of foods typically. And it's not only fish. However, fish can be certainly a very important part. Another way that you could learn about the information here is, in the context of fish and fishing, right? Not simply, contaminants or even food. It could be in a broader context of fish and fishing. And there's other opportunities in that sense too. And finally, we're just thinking about the range of perspectives within audiences. It's hard because even if you drill down to a certain level of detail for a given population, we really can't presume that we know everything. And we have to make sure we're very careful in designing our messages and figuring out, again, how to reach people who need it the most. At the Department of the Environment, we recently have convened a fish consumption work group, and we're thinking about a lot of issues. And we're thinking about partnerships and needs and opportunities that are out there. One thing that we are going to talk about shortly is how to find the best local contacts, and really how can we really engage people who need to hear this message. Again, the message is there. It's pretty simple. But translating that into meaningful change is certainly the challenge. And as always, we, the department, welcome input from all of you and from anybody about how we might best accomplish this. And thank you for your time. That concludes my presentation, and I'll be happy to take any, simple questions at this, clarifying questions at this point.
is there any other language that the advisories are in besides English?
Excellent question. Yes and no. All of them, the general ones, to my knowledge, are only in English, but we do have certain specific ones, like for the Anacostia, in Spanish as well. That's a great opportunity for us to expand upon. Amir, do you have a question?
Jed, thanks. Great presentation. My question is, are these data available, publicly available with geolocation?
They are not. However, there's a new database at MDE that could make that happen, although I don't know the level of discussions with that. But no, they're currently not publicly available, the fish tissue data, as something that can be accessed at present. That's great. Go ahead over here in front of Amir, ma'am.
Oh, yes, who got an experience there?
Really, yeah, and that's one that the team that does it at MDE, there's a lot of history behind it. They have a certain routine sampling schedule, 5 different locations, I think, in terms of 5 sets of locations around Maryland, around the Bay and everything that they test for. A lot of it's based upon prior results and realizing where the highest yield was in testing and everything. Because like pesticides, for instance, a lot of interest in pesticides. However, they don't test for them routinely everywhere because they found certain things drive the risk. And that's a good term to know, is what's the risk driver? In the years that MD has done this, they found that certain contaminants are the ones to look for, and certainly that's what they test for. And also, there are also considerations about the use of resources and figuring out how best to focus your testing. In terms of testing more areas for fewer things versus fewer areas for more things. So it's a constant dialogue and everything. Like for instance, PCBs tend to drive the risk in tidal waters and everything. And actually, Leslie had a slide that was very helpful. Mercury, in lakes, impoundments and everything. And again, with experience, it has really kind of helped to define how we do it. But it's a mixture of routine and history, I would say, for that. But it is also a point that we are open to and consider other contaminants, and both the feasibility of testing for those and if it's something that we can pursue. That's a good question. Thanks for asking it. Got a question over here, sir, behind Allison?
Sure. You want to go ahead? I've already had a chance. In DC, we have a challenge in terms of communicating our fish consumption advisory. And as the term goes, it's an advisory, it's not the law.
Right.
And people can catch the fish, eat it whenever they want it. And my personal experience and my staff's experience is that a lot of folks, they catch the fish, they catch the biggest ones,
Right.
which
Right.
has the highest burden. And if they cannot use it, they take it to the church and share it with folks that cannot have it. A lot of them are pregnant women and stuff like that. How do you bridge that issue of you cannot really ban this and reaching out to the folks and say, you may be thinking you're doing a good job, helping out, but it's really you're hurting the folks?
Right. That's a wonderful question, and I think that's one of those challenges. And it's about really, truly educating and persuading people and having them understand what it is. And that's a great question about the big fish and giving them to others who are in need. And that's something that I don't have an answer, but I think it drives home the point of the information's there. How do we engage populations and really help them out? And I think part of it is making an effort perhaps to find specific examples of people who might be doing things, such as sharing the fish with others, and going to that level and educating. But I think that remains one of the challenges that we're currently considering. Yeah.
Sorry, I know there's at least 5 other questions. Is this a comment specifically to this point?
Yes,
Okay.
yes.
Do you want to, and did you have a comment specifically to this point? Okay. Let's take like literally just quick comments because we're going to open everyone up at the end. I just want to give Cliff time to have his presentation also.
I was just wondering with respect to that question, how food access fits into that, and it seems like if you're setting out these advisories that, are you also partnering with the groups that are trying to open up other channels for people to access food, especially if they're
Yep.
suspicious?
The answer at present is no, not currently, but that's an example of partnership that would be very helpful. Because one of the things you wonder about is if you follow advice and avoid certain fish, what are you going to substitute that with? Do you have anything to? And if you do, what is it? Is it something, a fast food restaurant, for instance? You can have advisories for a lot of food out there, and it'd be interesting. But in any case, that's an excellent point. Thanks.
I just wanted to know if there was an effort in place to engage community stakeholders and being messengers for this in terms of both health practitioners and also news anchors, public access channels, sort of where they could convey that information.
Yeah, thanks, Alison. To a certain degree, yes, in terms of, like, for instance, in 2011 with our press event for the striped bass data and change in advisories, there was that to some degree with the press. However, your point about community points of contact is one that we hope to expand upon shortly, and that's certainly being discussed at our department. So,
Thank you.
thank you.
And I know there's some others. Just hold on to those for a few more minutes until we bring the camera up. Thank you.
All right, well, we've done enough talking. Actually, you've heard the best parts of the talks. From here on in, it's all downhill. So, first of all, what I'd like to do is recognize all the children in the audience and actually ask them a couple of questions. So, all those who are children, please raise your hands. Okay, those who are actually children. We'll get to the people who consider themselves children in just a minute. Okay, but for the actual children in the audience, so when you think about the Chesapeake, what do you think about?
All the marine,
Mm-hmm.
the water mostly,
Yep.
and it like moves the people around.
Okay, cool. All right. So the marine life, the people around it, and so for those who consider themselves children, what else do you think about when you think about your interaction as a child? If you were a child around the Chesapeake, what do you think about in terms of your personal interaction as a child with the Chesapeake?
Swimming.
Swimming,
Fishing,
fishing, okay.
any water sport.
Water sports, okay, yeah.
Playing in the mud.
Playing in the mud. There's my kind of guy. All right, excellent. So no, one of the challenges we have is figuring out, I'll actually get to the talk in just a second, maybe. But one of the challenges we have is, when you talk to people about the environment, there's many of you, some of you probably know Dr. Jerome Paulson, who does this wonderful exercise where he has everybody close their eyes for 30 seconds and then imagine the environment. And then he has people raise their hands and say, so how many of you saw, what did you all see? And people see Bambi, they see Forest Glen, they see the Chesapeake. And then he says, how many of you see people? And nobody ever sees people. I mean, one person. This audience I know would be different than that. So I'm giving you the benefit of the doubt because you obviously understand that we are not separate from the environment. We are part of the environment. And so I think your answer really just shows exactly, you see both marine life and you see yourself playing. And that's pretty much the challenge for the Department of the Environment, for the Department of Health and Mental Hygiene, is thinking about the following question, which is, we are looking at the health of people, but you can't look at the health of people without looking at the health of the environment as well. And so when we think about children's health, we're thinking about children's health writ large. So we're not just talking about questions about individual exposures. We're looking at what is it that children are doing over their lifetime. And if we're talking about the Chesapeake, how is it that they're interacting with the Chesapeake in ways that affect their health? And I want to talk about that for a minute because it's not just about chemical exposure. It's also about everything in environmental health. So just to sort of tell you a little bit about the Environmental Health Bureau. So if you're looking about an environmental health between me and Dr. Miller, what are we interested in for children's environmental health? Well, I think you actually said this right at the outset, which is, and here I'm going to torture the videographer in the back just because I'm going to move out of view, because I don't want her to get bored. But you know, we have to look at everything from safe food to safe water, safe air. We talk about safe housing. We talk about where is it that the parents work? Because part of where childhood exposures come from is from where your parents work. Lead workers, for example, bridge painters, people like that. That's a real source of exposure. Safe places of recreation. Again, I go back to my young scholar here who actually pointed out that, you know, it's where kids go to learn. It's the value of the Chesapeake as a place where you can learn as well. But we talk a lot about issues related to drowning and injury prevention. And I don't want people to forget about the fact that several hundred children drown every year in water bodies. And so when we talk about childhood health, we have to talk about injury prevention as well as chemical exposures. And then finally, I would be remiss if I didn't remind you all about the importance of kids in safety seats. So I've just done my public health promotion in general. And so our role, and when I say the health department, I actually am really talking about both the Department of the Environment and the Department of Health and Mental Hygiene. And one of the reasons is, historically, you probably all know that actually the Department of the Environment was originally the Health Department. And when we talk about environmental health, we're really talking about the intersection of the physical environment and people's health. And that physical environment includes everything from injuries and injury prevention to chemicals and chemical exposures to sunblock. I'm not going to ask, but I assume all of you who are parents regularly apply sunblock, because when kids are at the Chesapeake swimming, one of the big risks that we want to try to protect from is sunlight exposure. But we're really talking about opportunities to help people make decisions for themselves that, as Jed said, will make maximal use of the data that we have to make informed decisions. We are not smart enough, and I think that this is part of, what Dr. Miller and Dr. Quiros said. There are many potential risks out there, and for all of us, the choice is not between absolute safety, that is to say no risk, and something else. If you're alive, you're basically at risk of not being alive, because as organisms, you know, we live in an environment in which we interact with our environment, and basically what we're trying to do is figure out ways to live healthily, to minimize risk, particularly for those who are at greatest risk, and also to provide balance. And that balance is provided by providing people with information so that they can make choices based on their individual needs, their collective social needs, and very importantly for this conference, because we know that there are disparities in terms of exposures that people can't or are not allowed to choose for themselves, we need to make extra dispensation for the fact that we're not all starting from the same place, and that therefore there is a need to protect people who don't have choices about where they start. So there's a real need for us to develop public health prevention strategies that are based on providing information, and as Dr. Miller pointed out quite rightly, there's always going to be a balance. There's going to be a balance between healthy consumption of fish versus unhealthy consumption of corn chips or fast foods of some types. And what we want to do is allow people to have access to as much information as possible so that they can make those choices. and feel comfortable that they are doing the best things for themselves and their families. So I want to talk a little bit about some of the things that children's environmental health writ large are doing in Maryland in the coming year that will, I think, point out the importance of using data and information to make choices. So many of you may know that in 2012, the CDC, the Centers for Disease Control, actually lowered its, what was previously its limit for level of concern for lead poisoning from 10 micrograms per deciliter to a new level of concern that is 5 micrograms per deciliter. So this coming year, we're going to be working very closely with the Department of the Environment to put out information and guidance on revising our strategy for who should get tested for lead poisoning. In addition, we are looking a lot at issues related to asthma and prevention of and improvement of asthma outcomes. And why is this related to the Chesapeake? It's not, but I'm putting it in here as an example of what the Affordable Care Act has allowed us to do, which is to think more globally about not simply treating asthma, but also looking at preventing asthma exacerbations by doing a better job of looking at asthma triggers and reducing those asthma triggers in the home. To fracking in Marcellus Shale, and I would be remiss if I didn't embarrass Dr. Sepkoda and Dr. Milton, who are in the back of the room there, in identical suits. I can't figure out how it is that the two of you managed that, but I think that's very impressive. Who are the lead authors of the first public health study in the nation of decision-making regarding Marcellus Shale to be released before the decision about whether or not to do development of Marcellus Shale. And it's another example of how providing information to people in advance of a decision allows people to make a decision. And it is a decision that the entire state will make collectively, but it is a decision that now is going to be informed by a much better understanding of the potential health risks. And now let's talk about climate change. Actually, there's a panel going on now on climate change, but I would be remiss if I didn't point out how many of you live within 50 miles of the Chesapeake or some other part of the shore? Basically, most of you. So not if, but when sea level rise occurs as part of global climate change, remember I said part of the environmental health responsibility is for safe housing. Well, one of the big challenges we have is that a huge percentage of the world's population lives in areas that are going to be affected by global climate change and sea level rise. And so one of the things that we need to be thinking about is not simply what is the health of the bay from a chemical point of view, but from a housing point of view. How do we look at the interaction of where people live, where people recreate, and what the effects of global climate change are going to be on the Chesapeake and Maryland as a coastal state? Harmful algal blooms and Vibrio. So there are, in addition, we've mentioned fish advisories for chemicals. Well, it turns out that if you raise the temperature of the Chesapeake, you will also increase both the concentration of Vibrio and the number and frequency of harmful algae blooms. And we're actually seeing already a change in the pattern of those blooms, which are also affected not just by climate change, but also by nutrient runoff. So there are, and Dr. Quiros already mentioned the issue of pesticides and how to use pesticide data to help drive decision making. So if you look at how children interact with the environment, they eat, they play, they go to school, all of these things are major issues for environmental health and children's environmental health, as well as global climate change, which is certainly an overwhelmingly important environmental health issue. But at the end of the day, the question I think for all of us is that if you look at ultimately what the effect on children is going to be from interaction with the Chesapeake, you can't talk about these health outcomes individually. You have to start thinking about them as a global totality. And that's where I think the issue of looking at changes in healthcare and healthcare delivery models, thinking more about prevention, leads you to think about new ways of talking about and measuring risk and talking about and interacting with the public in issues related to decisions about risk. Dr. Miller and I have been working with Deputy Secretary Kinsey and a group at the Department of the Environment on issues related to cumulative exposures. And one of the things that we really are not very good at right now is thinking about how do we measure and look at the issue of a combination of exposures. So you take a child or a group of children, you put them at, you talk about their interaction with the Chesapeake. That interaction is informed by what they're eating, how they're playing, their social stresses, and the environments in which they live, their risks of injury. All of that stuff together goes into thinking about risk. And frankly, we are not smart enough to be able, for any of them, to talk about with parents and caregivers how to balance those risks. Because we're just not very good at that right now. So the best we can do right now is help people to understand, just as Dr. Miller was talking about and as Dr. Quiros talked about initially, the best thing that we can do right now is to acknowledge that there are cumulative and complex risks. We should be honest about the limitations of our understanding about how all of those interact, but we should also help people to sort those things out. And a lot of that sorting out is going to be a discussion with and a conversation with people as opposed to our making decisions about how to balance risk. So a lot of this is going to be, how do we create a conversation with people in which we can present data. We can present data that is, as far as we can tell from an expert point of view, and there is a role for expertise here in terms of analyzing the data and presenting the data in which it can be discussed, and then allowing people to weigh those data and inform us iteratively how to present that data or those data in a way that then allows people to make choices for themselves about how to live. And right now, we're sort of the very primitive stages of this. We issue advisories, guidance, recommendations, but you can see from our discussions about children's vaccine, for example, that oftentimes people are making complex decisions based on information and misinformation, and part of our job is to help people sort that out, not by necessarily giving them rules, but essentially by engaging in a conversation with them about these are the data, these are how we interpret the data, and then finally, so let's talk about how to interpret those data in light of your particular situation. And I think we are going to do a better job of that when we get to the point where we have good tools both for presentation of data and for including people in the regulatory and advisory process in a way that essentially puts more of the shaping of the regulation up front, as opposed to having the regulation take place and then presenting the regulation to the public. We need to have a better process of including people in the decision-making and regulatory process. And that is, and that is where issues like health in all policies comes in, because rather than talking about a regulatory process which is a bunch of, and let me just be fair about this, guys like me sitting in a room, coming up with a regulation and then saying that's the regulation, instead a process in which we think about doing exactly what the Marcellus Shale process has been, and I don't, and you know, I hold that up because it's a process in which health impact assessment, or something that's similar to the health impact assessment process, is used to involve the affected community in not only generating data but also shaping the questions, and then engaging in a dialogue with the community, in this case the community is the state, in terms of then using those data to come to a decision. And the decision might be yes or no, but more often than not, because we're always balancing these risks, the decision might be, so how do we understand those risks and perhaps mitigate them by creating some alternative trade-offs that will help to at least trade off some of the risk? Because rarely in life are we going to get a situation where we can say a decision no means no risk and a decision yes means complete risk. Most of the time it will be how do we shape our decision making between competing risks, and that's a decision making process that is best served, I submit, when you involve people who are directly affected from the outset in the decision making process. So I'll sort of stop there. Then I guess, and say it goes to you.
Thank you, Cliff. Why don't we invite everyone up from the panel? We'll put the screen up so you all don't hit your heads. Take 10 more minutes if we have any remaining questions with the full panel. Yes.
I was going to ask, have you been working with risk communication specialists to try to get the message out, convey the message to the community at all? So like use different techniques that may be more appropriate for the communities at risk? Are you working with risk communication specialists?
So when you say you,
Or just any?
are you talking to me?
No. Just
To quote Taxi Driver,
No, just anyone.
to any one of the panelists. So I would defer to you folks first. And
Thank you. Not specifically in the sense of consulting somebody in that sense, but certainly it would be a nice thing.
So I think one of the things that, and here again I will acknowledge Dr. Milton and Dr. Sapkota, one of the things that they did was actually include an anthropologist in the group of people who was working on the Marcellus Shale project, and did a lot of both listening and direct interactive sessions with folks in Western Maryland as part of this process. At the Department of Health and Mental Hygiene, we actually do work with risk communication folks on, and not always very well, but I think that there is, as Dr. Miller pointed out about the issue of media, you know, this works both ways. We've all become so dependent, especially at the state, on thinking that the way we reach people is through web pages, tweets, retweets, and I'm beating a hasty retweet on this one, which is that we sort of forget there are many, many different forms of communication, which goes all the way from web pages to that indirect communication that happens at barber shops, in neighborhood churches and centers, and we have an Office of Minority Health and Health Disparities that actually attempts to get into communities through communications partnerships with those organizations as well. But we've got huge room for improvement in that.
Yeah, I'll add to that for the whole field of children's environmental health for the most part, and I will say environmental public health in general as well. We've been acknowledging we haven't necessarily been communicating that effectively. And to be fair, we don't all have communication specialists and we don't have communication directors, and so that's not the cop-out, but that's a good way of criticizing even our own work. So much great levels of partnerships and resources and tools that are currently available, yet many to still be developed. We acknowledge that there are many different streams by which we now have to think about not just the message, but who the messenger is and how it's crafted. Because there's been a lot of money. The American Public Health Association and ASTO, the Association for State and Territorial Health Officials, put together about $1 million between the two organizations in the last couple of years to work with the Frameworks Institute. Many of us don't have those that type of capital to do so, but their results, they're sharing, it's on their website with all of us, which is bottom line, they found after doing focus group after focus group, environmental public health, certainly children's environmental health, doesn't necessarily resonate with the general public. They don't, they need a little bit more. We couldn't like have that tagline, on a bumper sticker. That wouldn't do much for us. It could be social services, which we know our work intertwines with all of that. But at the end of the day, just to your point, whether it's the ability to hire, in many cases, which our state officials are trying to do, that professional capacity, all of us need to constantly be asking ourselves, how do we best get the it out? We're doing all this work, we have these great partnerships, how do we effectively, and constantly asking that question would be really helpful for all of us. I know we ask that all the time.
I'm Len Souza. I live in Lusby, Maryland. As the crow flies, I'm about 3.3 miles from Cove Point. At Cove Point, Dominion Energy is in the process of building a $3.8 billion refinery / liquefaction facility. There's a small group of us, the Calvert Citizens for a Healthy Community, frankly feel isolated. We are puzzled that state and federal agencies have approved this transaction without any serious effort to evaluate health risks to children. And I ran for delegate down there. I did door knocking. I was stunned to find that most households who didn't have children in the age range of 2 to 3 to 4 years old didn't really care about the health risks that they were subject to living within literally 40, 50 yards of the facility. But they were worried about property values, and it was very difficult to get them engaged in things. My question is, how do we get the Department of Health, Department of the Environment, to first of all, measure the amounts of pollution that are going to be coming into the environment from this facility when they begin operations in 3 years? 2, how are we going to get these two departments to evaluate the risks that these levels of pollution are going to present to children? And 3, how are we going to get you engaged in helping us cope with this? I take your point. We're not going to get 100% elimination of Dominion Cove Point, but I'm not seeing anything that's going to enable us to go from 100% of whatever Dominion wants to do to forcing them to reduce the amount of pollution, particularly since they have paved other areas to allow them to pollute more. What do we do? Where do we go? We're desperate.
You want to take a crack at this first? Or do you want me to take a crack at this first?
Go ahead. That's
Okay. No, and that's fair, because I have less skin in the game than the Department of the Environment, and so in deference to the Department of Health and Mental Hygiene does not play a regulatory role at all in this decision. So let me just talk a little bit about the general question you are raising without necessarily addressing the decision about citing, because that's not I don't have skin in that game. So I think that the question we're confronting across the state is with a lot of these projects, and frankly, the similar kinds of decisions can be asked, and particularly in environmental justice, from an environmental justice question, about how you make decisions about projects such as Cove Point. And the same could be asked of the Purple Line, it could be asked of major developments, incinerators, et cetera, et cetera. And part of the work that Deputy Secretary Kinsey has been leading, in fact, and I have to give credit here to a number of legislators who have said, look, when you're making decisions about this, oftentimes the decisions, when we decide to intervene, oftentimes people focus on the permitting decision. And in many cases, it's not the permitting decision where the original question lies. It starts back with zoning, it starts back with planning, and it starts back with land use decisions that actually lie with local governments. And so in many cases, I think, part of what we're attempting to do, and there is actually an effort going on now between my office and the Department of Planning to develop a suite of tools, and I mentioned environmental public health tracking, but to develop a suite of tools which citizens, planners, planning organizations, and others could use, where what they could do is essentially say, take a map of, in your case, Lusby, and then look at health statistics, social statistics, demographics, population age, population income, and look at that historically and look at it in relationship to other neighborhoods, comparable neighborhoods. Because a lot of this discussion has to do with the question of cumulative risk and cumulative exposures. And again, we may not be very good at predicting exactly what those risks are, but right now, in many cases, we can't even provide you as a citizen or a planning board locally with information about what the underlying health status is of the population. How many children are there? Are there more children in this community than in comparable communities? What's the underlying health status of those children? Mortality, morbidity, major causes of hospitalization like respiratory disease, etc. So right now, we don't have the granularity to be able to provide those data in a way that you could then look at your community and say, so how is it that if you were going to make a decision about siting another facility here, that you could take into account the fact that this is already a community which might have additional stressors because of other industrial facilities, a poorer underlying health status, a higher degree of socioeconomic stressors. And it's what we're attempting to do now in the Marcellus Shale project. One of the things we're working on is a map of Western Maryland where you could actually overlay many of those factors together. So I guess from my point of view, I think the first and one of the most important things is to allow people very early in the process to have access to the kinds of data that they could then use in terms of planning and decision making to be able to not only intervene but to shape the questions right at the outset. And I'll turn that.
If I can make a comment, please. What you're saying is equivalent to what the Maryland Department of Highway says when there is a dangerous intersection. They say, there haven't been enough people killed in this intersection to justify putting in a red light. My question is very specifically, what can we do, and I'll reduce my 3 questions to 1. What can we do to get your help, MDEs or Department of Health, to measure the amount of pollution that's going to be coming from this facility? We want to be able to get an idea, an indicator of what the risks are to people before we have the clinical data that so many children have gotten sick. We want to be able to start building an argument beforehand that if we see that data, we will have a set of information about the amount of chemicals coming into the environment those children have ingested, so somebody can't say, well, this is totally unrelated, this would have happened normally. We need data, we can start collecting it now. How do we get it?
I'm unable to speak specifically about the permitting process in that context, about that project, but what I can say is that engagement in the permitting process, and again, I don't know if that could be written into a permit, that's not my area of, that's not within my domain, but whatever interactions during the permitting process there can be with the community, that's when there's an opportunity for these kind of issues to be brought up. Beyond that, again, I'm unable to comment on any restrictions or anything else that could go along with permits or things of that nature. But I'm also happy to pass your question, your concern along to the department. Permitting is its own realm in a sense, and there is a specified procedure by which things go. And I know community involvement and making sure that citizens have the opportunity to voice opinions is a big part of it.
And this is why we're upset, because that permitting process, for example, requires the formulation of an environmental impact statement, which we were not able to get. Instead, MDE used one that was done in 2006 for a facility that was much smaller than the one that's going.
So I'm happy to engage in conversation with you. I don't want to take everybody else's time in case there are other questions, but I do want to acknowledge, again, you know, I think part of, and again, I realize that this is a very controversial topic, and I think in many cases like this, one of the important things in addition to do is to think about how to reach out to academic institutions, to think about partnerships, because not all this monitoring can or will be done by government agencies. Right. It's possible to arrange for other kinds of environmental exposure assessment as well. So I'm happy to talk with you offline and afterwards about that, again, partly because it's really not, it's really going to be more of the Department of the Environment.
So let me just get, this young man here had his hand up a while ago, and then we'd probably unfortunately have to close, and I would encourage you to just grab the speakers because I know another session comes in and I want you all to have a chance to have a quick stretch break.
Yes, the question that I have, in reference to the various alerts that will come out in relationship to possible contaminants of various seafood, fish, et cetera, et cetera. How does that align itself with fish brought from outside of the area?
Thank you for raising that point, because it's a very important point. What I was talking about is specific to fish caught from Maryland waters. There are other sources of information for the store-bought realm, assuming that the store-bought means means that you don't know, a specific water body in Maryland from where it came, from whence it came. The FDA and the Food and Drug Administration, as well as the U.S. Environmental Protection Agency, federal agencies have prepared joint advisories that are available from those agencies. There are also multiple groups and other agencies and organizations that have general advisories out there as well. So really, there's probably, say, a wealth of things that you could look at. I would suggest specifically looking at the joint FDA EPA advisory, which is available on their web pages. But in a nutshell, that's the answer, is that that's not our purpose, anything with store-bought fish. That's something that is covered, number one, in general information, as well as the advisories that come out from the federal government.
Rich, real quick. Hi.
Well, just to follow up on that, to me, it's really a problem that there's no advisory at the point of sale. Because when you go to a fish market or the supermarket, there is nothing.
Yeah.
If you go to Whole Foods, it'll tell you if it was sustainably caught, but it will not tell you the mercury content of the fish, it will not give you any health information. So to me, if the public were to do something, it would be to ask the state, why don't we have advisories at the point of sale, and why not? And could there be? Because I know, I talked to some woman who was of childbearing age, and she was buying some swordfish, and I said, you really shouldn't be buying that, because it's very high mercury, and she was not aware. And she said, well, there's nobody telling me that, I don't see any sign. I said, yeah, you're right, but there should be.
So I have to admit, I actually run the food protection division of the Office of Food Protection for the state, so that's sort of my bailiwick. The simple answer to that, and it's not a simple answer, but the Food Safety Modernization Act had under FSMA, the Food Safety Modernization Act, as you may well know, the FDA is working with states, the industry, and others to think about how to improve consumer information about a variety of things. And they're starting with the big ticket item. In this case, they've just issued a proposed rule which would have to do with calorie counts and menu labeling at fast food and chain restaurants, and vending machines as well. So as we mentioned, this is always a question about multiple risks. And if you ask about, and from my point of view, one of the big risks is calories overall, because that's one of the big health drivers, both for chemical exposures and for health overall, is the amount of fat in the body. So the simple answer to your question, I think, is that you're going to see over time, I believe, an effort towards more communication with the public about nutritional questions. I think it's going to be a slow process all along the way. I think we will certainly pay attention to that, but it's going to be a struggle just to get stuff on about calorie counts. When we get to the point of nutrition labeling, and Dr. Quiros may want to comment about that, but from a risk point of view, a risk communication point of view, we're trying to balance two things, which is having a label that you can read and understand and presenting enough information so that you can make decisions. And frankly, it's not an easy task.
No, and I think, back on that, I think culture has a lot to do with it also, right? Where we come from, what we're used to, what we grew up with, it's very challenging.
And as far as the messenger, healthcare professionals, many of us have been working for decades to continue to bring this basic environmental health information to their practice, which is not anything that the general medical and nursing practitioner, generally speaking, still gets. So that's yet another opportunity. Many of you remember where the FDA had advised 1 can of tuna if you were pregnant. Now they recently came out and said no tuna. That's the advisory. So simple, not simple, but there is an opportunity in your prenatal visits as well for those that do have insurance, that's a whole nother thing, where they can get some of that basic guidance while some of these other provisions are still being worked out. I'd like you to help me join our wonderful panelists in giving them a round of applause. And thank you for your attentiveness, and sorry to keep you, but that obviously has been a very good discussion. So thank you. Enjoy the rest of the conference.